Thanks so much for joining us today for Why Comics Work for Risk Communication. My name is Sarah Levin-Lederer. I'm an Outreach and Education Coordinator for Region 7 of the network of the National Library of Medicine. I'll be your host for today's session. A few just reminders and things to be aware of. Everyone has been muted to limit background noise, but we do welcome your questions and comments at any time. Please use the chat function to share your comments and questions. And Molly Knapp and Erica Lake, two of my colleagues from the network, are providing production assistance today, and they will be keeping an eye on your posts. They'll queue up your questions as they come in and save them for our speaker to address at the end of her presentation. As a reminder, by registering for this webinar, all attendees have agreed to abide by the NNLM Code of Conduct to foster a respectful and professional learning environment. Closed caption has been enabled and is available by clicking on the icon at the bottom of your screen with the 3 dots and then selecting closed caption. We are recording today's presentation and we will post it on NNLM's YouTube channel in 1 or 2 weeks. At that time, everyone who registered for the session will receive an email from us with the link for the recording, so please keep an eye out for that. This webinar is eligible for Medical Library Association and CHES Continuing Education Credit, which you'll be able to claim through the evaluation link we share with you at the end of the session. And please do fill out the evaluation. Your feedback really matters and helps us improve future trainings. So we do appreciate the time that you take to complete it. Since some of you might be first-time attendees to one of our webinars, I'd like to take a moment to share who we are. And so the National Library of Medicine, or NLM, is one of the 27 institutes and offices of the National Institutes of Health. It's the world's largest biomedical library and produces online resources like PubMed and Medline Plus. And NLM, the network of the National Library of Medicine, is an outreach program of NLM working to ensure health professionals and the public have equal access to health information. And NLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 NNLM member organizations. If you'd like to connect with your regional medical library or learn how to become a network member, you can check out the website at nnlm.gov. Today's session is part of the NNLM Virtual Disaster Preparedness Forum, which is taking place now through the 28th of September. The forum features expert speakers presenting on data tools and resources, disaster planning, communication, and institutional preparedness with a focus on greater inclusiveness and community resilience. You can learn more about the forum and register for the upcoming sessions by checking out the NNLM training calendar, and we'll drop the link for the training calendar into the chat. We're also excited to highlight a collaboration with another NNLM program. In observance of National Preparedness Month, the NNLM Reading Club has selected 3 books and gathered information from trustworthy sources to help you take action and stay safe. More information is available on the NNLM Reading Club website, and that link will also be added to the chat as well. With that, I'm excited to introduce our speaker for today's session. Dr. Meredith Li-Vollmer is the Risk Communications Manager at Public Health Seattle and King County in Washington, where she has worked in emergency preparedness and response since 2006. She has served on numerous national advisory roles for organizations, including the National Academy's Committee on Increasing National Resilience to Hazards and Disasters. Meredith is also active in the field of graphic medicine as a cartoonist and an author. Her book, Graphic Public Health, The Comics Anthology and Roadmap, was published in 2022, and her comics have been published in The Stranger, Illustrated Pen America, and the American Journal of Public Health. Meredith received her doctorate in communication from the University of Washington. Welcome, Meredith, and I will stop sharing and turn it over to you.
Thank you so much, and happy National Preparedness Month to everyone. I'm gonna, hopefully you can see the screen there, so everyone can see that. Great. Okay, well, I'm really happy to be here, and this presentation is actually like a perfect combination of my strong interests in comics and in risk communication. It's really wonderful that I get to really focus in on comics for this one particular area, because as you heard, I've been doing risk communications for quite a while here at a local health department. And so that means, I do a lot of work with hazards and disasters in the public health arena. So obviously a lot of public health communicable disease outbreaks. It also means I work on issues like boil water orders, or there's a lot of different public health aspects to a lot of, every disaster has public health aspects, whether that's flooding and you're dealing with mold and mildew, and or wildfire smoke, or, heaven forbid we have the catastrophic earthquake, but certainly we have that potential here in Seattle and King County, Washington, and there are huge public health impacts. Even windstorms have big impacts. So I work on a lot of different issues in emergency preparedness. This is a panel from a comic strip I did that was detailing what's been happening in the COVID pandemic response. So our area had the experience of being the first jurisdiction in the United States that had a diagnosed case of COVID-19, and we had the first outbreak and unfortunately the first deaths in the United States. And so this is a panel that shows those opening weeks, and that's me in the middle, and that's what it felt like. So today I'll be talking about how risk communication and comics can work together. And first, I know that not everybody here may be very familiar with what risk communication is, so I wanted to start out with that definition. And so I'll just read here that risk communication is the dynamic, interactive process of sharing information strategically and effectively about an issue of high concern to help people cope, understand risks, and make informed decisions. And so it's that part that I've highlighted there in yellow that's really my focus of, how do we help people get through? How do we help them understand how they can protect their health in situations that can feel very dire, or sometimes there are situations where people may not understand the urgency and we have to help them understand. So I'm going to be talking about how comics, I think, can really work to help with risk communication, and I'll be focusing on three different periods of a disaster. So we'll be talking about how we can use comics in actual emergency responses, and how we can use it for emergency preparedness, and then also how comics can be used in the recovery period. And as I go, I'll be talking about some of the key risk communication principles and how I see comics fitting with those. So we'll start out talking about comics for emergency response. So how can we use them when we're in the midst of some sort of urgent situation? And I want to start out with a risk communication principle here, thinking about how people gauge risk, because I think it's really important when we're talking about communications that we understand where people are so that we can communicate better. And so here, I think it's useful to think about risk as a combination of hazard and emotional stress. I've adapted this from Peter Sandman, who is a risk communication specialist. He uses the term outrage. I prefer emotional stress because I think it covers more and is more descriptive for a wide variety of feelings that people may have. But he made the key point that when we work as professionals in emergency management, we think of risk in terms of the actual hazard. So hazard is what we know by the evidence base to be the real threat of a situation. And so that's where we are in public health. We have all the data. And so we're evaluating based on that data. But what we need to take into account is how does it make it feel? How does it make people feel? Because that is often how they're gauging risk. In times of disaster or in situations where it may feel very high urgency, people are experiencing a lot of emotional stress, and that's going to affect how risky they view the situation to be. The stronger their feelings are, the more risky they may feel a situation is. And we also need to take that emotional stress into account when we think about how can we communicate effectively when people are experiencing that. And that's because people can't cognitively process information well when they're under stress. Those stress hormones are flooding their brain. That can lead to what's been described as mental noise, right? So I think we've all been there, like when you're feeling really stressed out, it's hard to think clearly, and people literally can't listen very well. They can't process necessarily all the information you might be trying to give them. And that, of course, has huge implications on how do we communicate with people when they're experiencing this kind of stress. I feel like comics can really help people get beyond the mental noise because it can help with another key risk communication principle, and that is to make information accessible. How do we make it easy for people to understand information quickly and efficiently when they are experiencing this kind of mental noise and they can't cognitively process information very well? And I think comics can help because they have a lot of explanatory power. So here I'm going to get into what are some of the key qualities of comics that I think can help in this situation. So here, this is an excerpt from our norovirus fact sheet. This is describing one of the main symptoms of norovirus. And I'm hoping that as you look at this, it's pretty clear what some of the symptoms you might expect to have from norovirus are just by looking at the illustration, right? So you don't, in this case, need to be able to read any text. You don't need to read a particular language. You kind of get the picture of, oh, this is the key symptom. But comics is more than just the images. So you have image and text working together. So here, this is from a flu, an influenza fact sheet that we have, in which you can see we've got some illustration here. We've got a sound effect. You've got a woman sneezing and another woman coughing, and then you see somebody touching a doorknob. So there's already some information here that you can glean just from looking at those images. But then when you add the text with it to help explain what's going on, it adds additional clarity. Flu germs spread when people cough, sneeze, or talk. If flu germs get on hands, they can pass the germs to other objects. So what we also see happening here is that these panels also produce some sequence, and the sequence has meaning. So here you've got the sneezing, the coughing, especially the coughing with the hand, and then you see the hand reaching out to that doorknob. And that is a sequence that gives you an idea, oh, this is how it happens. You cough here, you touch here. So there's additional information provided in the form of a comic strip. So when we think about when people are stressed out, how do we make information easy for them to understand? And I think about this also a lot in terms of in our jurisdiction. You know, we have a lot of different languages, you know, at least 50 different languages are spoken at home in our county. So we also need to think about how can we make this information easy to grasp when people might not necessarily read English, or we might not have translated it into every single one of those 50 languages. So this is an example of a comics page that we created to help explain isolation and quarantine. And we created this particularly because with people with active tuberculosis, we have had to have them stay in isolation, and trying to help make that understandable, what it is you can and cannot do, make it really clear. So what I'm hoping is that by having these comics that demonstrate things like, you know, riding on public transportation or somebody working, and having that red X over it can really make it easy and quick to understand, oh, these are all the things that I shouldn't be doing when I'm in isolation. And so this is a flyer that we make available to our staff who are working in the field with people who have to be in isolation. And in risk communication, we also talk about how if you want people to take action and actually take the protective steps that you're asking, it helps when people understand why. Why is this something that I need to do? What is the risk here? And I'm going to show you an example that's actually from a comic book that we did for kids, but we hope that families would look at this together and understand something. And so here, this is showing what to do during an earthquake. And we have, some of you may be familiar with drop, cover, and hold. And so in this comic strip, we have one of the little monster characters talking about, drop, cover, and hold if you feel an earthquake. And so then the other kid is explaining that you need to get under the table. And so what people don't always understand is what's with hold? What does that mean? Why do I have to do more than drop and cover? And I think understanding the why really helps. And so here we're able to show, right, there's all this stuff crashing down and the table is moving. And so if you hold on to it, he says, that way you can move with the table. And so that's a way of using comics to explain the why. Similarly here, we're showing in a rather dramatic fashion that in an earthquake, there can be a lot of glass that falls. And so here we can see, if you stepped on that with bare feet, that's going to be terrible. So you stick shoes under your bed as a preparedness step so that if there is an earthquake at night and the glass shatters, you can quickly put on your shoes and prevent a very common injury from earthquake. So again, using the combination of words and images and sequence to explain the why to take that particular preparedness step. Here's an area where I think comics is particularly effective and a form of communication that's hard to do. That there's a key risk communication principle that when people are feeling high levels of stress, right, we know that they aren't able to cognitively process what's going on, what they need to do. They aren't able to process the information you're trying to give them. A key thing that you need to be able to do is to help people cope with that emotion, right, so that they can cope with it and the stress levels start to go down and they're able to process better, they're able to take action better. And one of the key things that we advise communicators to do is to address the emotion, to help people get to a place where they can understand information. And this is where I think comics are particularly effective. So I think that we are able to really convey a lot of that emotion and help people make good decisions by using comics. And so, as a risk communicator, I think a lot about how people really need to know that people in public health who are making these recommendations, people at these agencies, really understand what people are going through during these disaster situations, or even not disaster, but stressful situations. Because I have found over the years that I've been doing this work that until people feel like you understand where they're at, they really aren't ready to listen to you. You don't have a lot of credibility if you can't understand what they're feeling. So this is a comic strip called A Very COVID Holiday that I wrote in 2020. And this came out in, I think, I started working on it in October of 2020. And at this point, we did not have vaccine. People had been already living in some sort of lockdown situation or, doing a lot of social distancing for some months now. And people were really already getting pretty exhausted from it. And we knew heading into the holiday season that it was going to be really hard for us to give the guidance that we knew we had to give, which is that that gathering with others during the holidays presented real risks, particularly to vulnerable people in high-risk groups, and that we were looking at the potential spread of COVID at a time before people were vaccinated. And so we were trying to think, how are we going to get any acceptance of this message, of this recommendation that people not gather when we know that people have been going through so much and are already exhausted and upset about all of this. So I wrote a comic strip about my own dilemmas, and that's a risk communication principle also, is to share the dilemmas, about how difficult it was for me to think about that and to make decisions. So in this comic strip, I talk about how I don't want to contribute to skyrocketing cases. But I have parents who are in vulnerable groups. So my father has dementia. My brother also lives by himself. He's diabetic, and he was staying home. And for me, it felt urgent to see them because I hadn't been there for them, and I felt badly, and I hadn't seen them. So here you see me talking to my parents over Zoom. But so I was trying to express how torn I felt, because I really desperately wanted to see them. But at the same time, my parents are in high-risk groups for COVID, and I worry that I could expose them if I travel. So here I show the ways in which I might potentially expose them. So the whole point, the comic strip goes on to show how I found other ways to gather with them, to have a remote gathering, which wasn't ideal, but it gave me something to meet outside with masks on with other members of my family. So to show, how that gets resolved. But the idea here was to show we understand that this is a sacrifice and we're asking a lot. And at the same time, our vulnerable loved ones are worth it. So that's where a narrative that you can do with comics, I think, can really help with that kind of messaging. And this is another one that I did later on in the pandemic, where we had been, so this is a continuation of that first panel that you saw at the beginning of this presentation. And this one was about the moment when the Delta virus appeared. And so the first panel shows that joy of the first vaccination, where this shows actually members of our communications team, many of whom we hired in the midst of a pandemic, and we'd never actually met in real life. So the joy of meeting in real life. And then that being suddenly interrupted very rudely by the arrival of the Delta variant, where suddenly the COVID cases were going up. And here what I was trying to get at was the frustration that people were feeling that, like, wait a second, we got vaccinated, we did what you said, and yet still people are getting COVID. How could this be happening? And so, here you see this person who's very frustrated, understandably so. What's up with the vaccine? How the frick are vaccinated people getting COVID at all? And so I think showing that real emotion helped us build credibility, because we knew that that people were frustrated, and then it was reasonable to be frustrated, right? So then the comic strip goes on to have a conversation between two friends, in which one friend is skeptical and the other friend is explaining, that that COVID vaccine is like birth control. Even if it's not 100% protective, you'd still use it, right? So we talk about how it's still extremely effective at what matters most, preventing serious illness, hospitalization, and death. And so having that conversation happening between these friends was kind of a more narrative way, a more relatable way of giving that information. And then the rest of the comic strip goes on to talk about where there's still hope, and provide information about getting vaccinated. But I think it's this ability of the narration to carry that emotional weight and to express empathy for what people are feeling that I hope made it effective. In risk communication too, and in emergency, those of you who work in emergency management, we know we need to reach the whole community with their messages. And that's really challenging, because there's a lot of different communities within the whole community. But one thing that we know about risk communication is that it's social, and that people do what we call milling before they make decisions about protective actions that they could or could not take. So, maybe the health department puts out a recommendation, get the new COVID-19 vaccine. And people aren't, of course, necessarily going to just instantly go out and do that just because we said so. So they're going to talk to people, and they're going to search for other information. Family and friends are going to be really important. They might get information from social media. They might get it from a community-based organization. They might get it from the news. But people are going to seek other kinds of information before they make those decisions. And so here I think an advantage of the comics medium is that I think people are drawn to the hand drawn, that there's something about it that stands out. We've and that they share it with other people. So here is an example of something that I put out fairly recently, a comic strip on tips for clean door air on smoky days. And so, wildfire smoke, I think, is now pretty much everywhere in the country. We've been experiencing it everywhere. We've been having it for the past several years here in the King County, Washington area. And one of the things that we've been talking about is the need to keep your air indoors as clean as possible when the air outdoors is really smoky. And when I first heard that, it kind of didn't make sense to me. And I didn't know what our indoor air specialists were talking about when they were talking about indoor air pollution. And so I thought, well, if other people aren't picking up on this right away, then maybe this is something to make a comic strip about. So here, this is me, and I created a new grumpy cat character to be the public health skeptic because I needed a foil to ask all the questions that I think people have and to have that skeptical questioning viewpoint, which I think people, legitimately have and that we should better understand. So here in the comic strip, I demonstrate ways to keep the indoor air clean. We have the cat asking when I say our lungs need a break, so we should reduce sources of indoor air pollution. The cat says, what does that even mean? Which was my first reaction, right? So talking about how vacuuming and sweeping can stir up allergens and how kinds of cooking can increase indoor air pollution. You can tell, when you can smell it in the air. And that candles are another way in which you can add pollution, so that those should be things we put away during these smoke events. And then letting people know that they can clean the air with an air purifier or make a box fan filter. So we published this comic strip, and it gave me the opportunity to do a direct comparison between different ways that we could share the information. So we had shared almost the exact same information as a set of slides on Instagram the previous summer. And then this was a set of slides in that comic strip form. They were about the same length, same information, just told in different ways. And when we compare this, there were about 1,250 likes on Instagram compared to 27 likes. 27 likes is decent for us, honestly. You look at the number of shares, that there were over 440 shares with it in comics form, 6 shares when it was in slides. I really take interest in the number of saves because that means that people are they're planning to look at it again. So there were over 140 saves, 22 follows. That meant that 22 people decided, oh, I saw this, I'm going to follow this public health account. And we didn't get that with it in slides. So overall, if you look at the number of impressions we got about 14,000 impressions in comics form and about 1,200 impressions when it was in a slide form. So to me, I feel like this is pretty compelling to say, there's something about this hand-drawn and this narrative storytelling that draws people. And the other thing in terms of thinking about, how do we make sure that we get this information flowing to the whole community? The comics do really work well in translation. One of the things is that when you work in comics, you necessarily have to keep the word count down, which is a hard thing to do. I have had to learn that over the years of how to try and get information more and more concise. But when you use fewer words, often it's just something that people want to look at more, but also it's cheaper to translate than doing a very dense flyer, handout, brochure. And so here's an example of information that we did about staying safe in the heat, because heat is much more of a health issue than it used to be here in our region. We had a heat dome a couple of years ago where it went up to 113 degrees in the Seattle area, which was just unheard of. And sadly, people in our region, we had deaths and we had hospitalizations. So it's something that we're focusing a lot more on. I'm holding up here how we could put these comic strips about how to stay safe in the heat into, this is a Chinese newspaper. What you're looking at in the slide is it in Vietnamese, and comics lend themselves really well to advertising, particularly in print. That's kind of where the history of comics comes from. So we were able to use it in that way. Here on the right-hand side, this is early on in COVID. We created this brochure that included comic strips in it for older adults about how to stay home safely. This is before there was vaccine available, and just giving tips for older adults about how to take care of themselves when staying at home. And so this one is in Khmer, which is a Cambodian language. We also do a lot of little mini comic books, fold some up, that are translated into different languages with information in it. So it's a medium that really works well for translated materials. And we've heard from people in different language communities that they really like getting information as comics. I do want to talk also, so far I've been talking about how I've used comics to distribute information when we're in the midst of an outbreak or other kind of public health emergency or urgent situation. I think they also work for emergency preparedness, and it's National Preparedness Month. I have to say that emergency preparedness is not something that really garners lots of attention from people, that it's not something that they want to think about. And so we have to be creative in thinking about how do we get any attention on this topic. And so my origin story with working with comics actually comes from doing emergency preparedness in 2008. Well, it was really 2006, 2007, I was hired to do pandemic communications. We were at that time concerned about avian flu becoming a global influenza pandemic. And what I had found was that, people could not get their heads around at that time about what I was talking about what a global pandemic would look like, because it wasn't in anybody's memory. And so it was something that I was having a hard time getting any traction on. And then I noticed that when I talked about what happened during the 1918 Spanish flu, as it was called then, people were really surprised to hear about it, were interested in the stories, were stunned that nobody had ever talked to them about it before. And so that's when I came up with the idea. I was reading about comics from a book by Scott McCloud called Understanding Comics, and I thought, maybe there's something to this, maybe we could use this. So we developed this No Ordinary Flu comic book that tells the story of what happened to a family in 1918 during that influenza pandemic at that time. And so we had this narrative going, and at the same time, we were able to include information about what might happen if there was a pandemic in the future. Now these things look familiar, but in 2008, people, I think it helped them to have this in illustration with the text to make what was then unfamiliar concrete. So here we've got images of closed warehouse, and we have empty workspaces and canceled events and emergency rooms that are overflowing, and concerned healthcare workers in what we were then envisioning as a avian flu influenza or a pandemic. Now this looks familiar, but at the time it was new, and so it was to help people connect to doing what we call mental rehearsal for what could happen. So having that kind of idea that this is possible in their heads. We've also created other comics that we have ready to go in case there are other kinds of emergencies. Fortunately, this is one that has not happened, but these are some comics that I created with David Lasky, who is the artist who I worked with on No Ordinary Flu, in the event of an anthrax attack. And in an anthrax attack, the public health department has to get antibiotic medication to people who are exposed within 48 hours. And so if it's something that is airborne, it would be a very, very challenging situation. And so we created these comics to help people understand, again, thinking about if they're feeling emotional, how can we make it easy to understand by looking at the picture of what's going to happen, helping them get in their minds, okay, I could expect to hear on the news that health officials are saying to take the medication in the next 2 days. And then I might expect to show up at a school gym where they're giving out medication and I have to go pick it up for me and my family. So just having that ready to go so that if, heaven forbid, there is an anthrax attack, we have those informations. We've created some flyers that we have ready to print, to put on the web, to put on social media, just to help people comprehend the information quickly. Oops. I also feel like that the narrative power of comics, we talked about, how they can carry a lot of emotional weight. And I think people really relate to human stories. And, doing emergency preparedness where we put out tips of like, here's what you need to do to build a kit, and here's how you should put together a emergency contact list, that it's only really people who are already interested in emergency preparedness who really pay attention to that. And so I guess these came out in about 2010, 2011. We put together a series of comic books called Survivor Tales. And for these comics, we interviewed people who had lived through different disasters, and we created stories about what happened to them. So you can see in the one on the screen that this is one about a family in Chehalis, Washington that had a major flooding event, and they had a farm. They still have this farm. And the farm was flooded, and it happened quite quickly. They were evacuated by helicopter. And so this shows the family coming back to the farm and the shock and the emotion of seeing that farm for the first time. But then also that there was this emotion of finding out that their sheepdogs had herded their sheep into the barn, which was on higher ground, and had saved their sheep, and the gratitude that they felt for the dogs. And when they were telling the story, I just thought, oh, we got to include that because people want to relate to those stories of survival. And the idea was, people might not want to hear just about scary stuff. People often tune out if you're just going to tell them how bad it could be. But people are very interested in people who survive. And I was inspired by Captain Sully, the pilot who landed the plane in the Hudson, if you all remember that, and how people were very interested in his story. And so these are all stories about people who survived. And then I have them as the spokespeople. So that they are giving advice to people about, here's what you could do. Here, if we ask them, what would you tell people about how to prepare for something like this? And so they give the tips. And so here, the mother in this story talks about, how she puts her important paperwork in plastic bags and stores them in boxes that are easy to carry upstairs. And she talks about how she plans for her pets and stores pet food and water in an emergency kit, right? So then you give that information, those preparedness tips that you want, but you've done it within the structure of a narrative that people can relate to. And in general, comics are great because they can really reflect people's lives and experiences. And I think when you get that kind of resonance, people are more likely to pay attention to it and more likely to think about taking the steps we're advising. So this is from the Stay Safe in the Heat comics that I was referring to that you already saw in translation. And here are some panels in which we worked with community partners to develop this comic book. And we really tried to make sure that it affected, or that it illustrated the people who we really wanted to reach with this material, because we know that there are people in our county who come into the emergency rooms at much higher rates for things like heart attack, stroke, kidney failure during heat events. And they tend to be people who live in poorer quality housing where they don't have air conditioning, where they don't have windows that open even. They live in neighborhoods where they don't have as many trees. And so there are a lot of people who are in a lot of our immigrant groups who live in places that make them much more vulnerable to heat. So we worked, for instance, with our Somali Health Board to make sure that we showed people in the kind of garments that they actually wear. We had them review early drafts of the comics where we talk about where could people go to get air conditioning on a hot day. We originally had movie theaters in there. And the feedback we got from our intended audiences was that we wouldn't go to movie theaters. It's too expensive. So we made sure to include places that the community would actually go. And then this is my favorite panel because we talked to people about what are the cultural practices you already do to stay cool. And when we talked about what kind of hydrating foods do you eat when it's hot, these are some of the responses we got. So we illustrated this man from the Chinese community having winter melon soup, which was an aha moment for me because my grandmother, who lived in San Jose, California, where it's hot a lot, she always drank winter melon soup. And we even used the bowl pattern that my grandma used, which is a melon seed China pattern to make it look more authentic. And we had somebody from the Filipino community talking about shaved ice with fruit. So when we published these comics and the ads in some of our multilingual and community media, the publishers came back to us and said, wow, whoever worked on these knows something about our community. This really feels like us. And that meant a lot. And we've had a lot of requests for reprints of these comics from our community partners. There is one demographic that weirdly really likes emergency preparedness, and that's kids. So it made sense. Most of the comics I create actually are not with children in mind. They're really for all ages or veer more towards adults. But we have done some for kids. And so this one is from a comic book that you can color called Disaster Buddies. And we developed this one working with our Spanish-speaking community. We were trying to find out what seems realistic for your people in your community to actually do in terms of emergency preparedness. And they said, you know, making a kit isn't something that we feel we could do because we can't afford to buy stuff that we don't even know if we're going to use. We're just trying to make rent month to month. But what we do like is this idea of developing emergency contact lists and also helping out neighbors. And that's something we can do, but we feel like it's hard to meet neighbors in our neighborhoods if we don't speak the same language. So together we came up with the idea of what about if it was the children who make the introductions, because the children may know each other from school and so forth. So in this comic strip, you see these two monsters named Reddy and Freddy, who go around meeting the other kids in their neighborhood. But in that process, you see, oh, here are the parents also meeting each other, waving hello. And then when the disaster actually strikes, they offer to help each other out. So this tree is toppled in the windstorm. So then the next pages of the comic strip show the families working together to cut the tree and remove the tree. And so it was a way in which we could really demonstrate behaviors that people could do to help each other out in emergencies. We've also been using comics to create awareness of emerging hazards. And here in our health department, we've been trying to help reframe climate change as a health issue, which is becoming, I think, more apparent in very recent years. But when we started doing this, people weren't thinking of climate change as a health issue. So we created this mini comic book. I like these little mini comic books because I think they're very inviting to pick up and fold, and you can just photocopy them on colored paper and staple them and have them at libraries and clinics and community organizations. So in this comic book, Climate Change is Health, we hired an artist named Mita Mahato who does these beautiful paper cut and ink comics. And the idea was to have something that was so visually different and striking that people would really kind of pay attention even if they were really already tired or not interested in climate change. So here we demonstrate 3 different ways in which climate changes our health, in changing the air we breathe, in changing our exposure to disease carriers because vectors like ticks are migrating with changes in temperature, and that climate change has a real mental health impact. And so, we're trying to create this awareness about climate change as a health issue. I also think this is a demonstration of how comics can take something that can feel very wonky, can feel like very big picture. We often talk about climate change in terms of greenhouse gas emissions or carbon footprints and things that are not as relatable, I think. But if we can bring it back to the human scale and show how does this impact us as people every day, right now, then I think it can help pull people into the conversation because they do care about these issues of health. And then later on in the comic book, we talk about what does this mean then? What do we need to do in terms of actions we take, and particularly policies that we need to think about if we want to slow the pace of climate change. So we can take it from a big picture down to a human scale and then bring it back up into the big picture of policy, which is where we need changes. And finally, I want to talk a little bit about how during the recovery, how we can start processing disasters using the narrative of comics. And I wanted to show here a page from a graphic novel called A.D. New Orleans After the Deluge by Josh Neufeld. And I think it's a really wonderful graphic novel that follows different characters and what happened to them in Hurricane Katrina in New Orleans. And it really talks about the geographical situation, the sort of socioeconomic situation that people were in, and it helps you kind of understand different issues that impacted people and their experiences in Hurricane Katrina, and I think raises a lot of interesting questions about how to be better prepared for those kinds of events. I'm really pleased to see that you've got on your reading book list Fire Story, which is by my friend Brian Fees, about his experience losing his home in the Santa Rosa wildfires. I think it also, for me, there's pages where I have sent the images to people I work with in emergency preparedness as examples of, look, we need to be thinking about these communications issues. Here's what came up in Santa Rosa. So I think there's a lot of interesting processing about disasters that can happen through comics. One that I worked on myself with a artist named Hatia Garib. There was a project to tell stories from the front lines of the COVID pandemic, Frontline Comics project. And so I contributed one from public health in which we told the story of what people in our department went through. And really, for me, it was my own processing about, by the time this came out in 2022, we'd been through a lot, and we were really proud of what we'd achieved, and it was super intense. And at the same time, the level of burnout that people were experiencing and the kind of expectations that we put on ourselves as public health responders to COVID created what we started talking about as a culture of toxic excellence. And I really wanted to explore that as a way of thinking about kind of these emotional impacts on workers and the public health workforce. And it also brought me back to yet another pandemic comic that David Lasky and I did in 2018. And this was to mark the centennial of the 1918 flu pandemic. And so we did a web comic that was told in a series of 4 different comic strips about what happened very specifically in Seattle. And so here in this comic strip, you can see that there's a woman who talks about what happened in her family in Seattle. You see here, this is the mayor of Seattle and the Seattle's health commissioner at the time talking about, if thought necessary, every place of public assemblage in Seattle will be closed. And so here we see that the dance hall is closed. And we see that in 1918, Seattle public schools and the University of Washington were closed for 6 weeks. And so here you see the mother dealing with the ruckus that her children are making while schools are closed. So again, we did this in 2018. At the time that we did it, I remember we were using newspaper footage and archival information about what happened. And I remember coming across these photographs of women sewing masks out of gauze. And I thought, oh, how quaint. Look, they're making their own masks. And we illustrated that in there, not knowing that 2 years later, I would be sewing masks as well. But I bring this up because this webcomic took on a life of its own that continues to go. So David Lasky, the artist, I was heads down in COVID response in April of 2020, and things were fast and furious, but he contacted me and said, hey, people are contacting him about this webcomic that we did in 2018 and, wanting to understand better what to expect. And so I wrote a blog post for our health department's blog that talked about this comic and what the similarities and differences were between April 2020 and what we had depicted in this Pandemic in Seattle comic. And this blog post has been the second highest viewed blog we've ever put on our blog. That we've had, last I looked, 130,000 people had opened and read that blog post discussing Pandemic in Seattle, the comic strip. And we continue to get, I don't know, between 100 and 200 views every week. And we're heading towards the end of 2023. And I've been trying to make sense of why have people been so interested in this. And I came across a study by a researcher in the UK named Sarah McNichol, who did a study in which she interviewed people who read educational health comics about a health condition either they or their loved one was experiencing. And she found that in their responses, they talked about how the comics helped them relate to or respond to or remember information better than if it was offered in an abstract way. And more importantly, she talks about how the visual metaphors provided avenues for people to understand their own health conditions from other perspectives. And it prompted them to reflect on and re-examine their own understandings of what was going on with their health. Maybe that's what's going on with this comic strip. I'm not sure why, we continue to get so many hits on it every week. But maybe there's something in which the comics help people process what they've been through. But anyway, I want to leave a little time for questions, but just really feel like for me as a communicator, working in the comics has really opened up different ways for me to communicate and reach people. And I think has really changed how I think about risk communication in general. I'm happy to take any questions.
Thank you so much, Meredith. A couple of questions that came in. There were a few people wondering how you would sort of distinguish between an infographic, a comic, an illustration with text. What sort of separates those things?
Yeah, because, I use all those things in my work here at the health department, but comics are distinct, so you've got image, you've got text, and those, are often used in other forms of illustration, including infographics. What I think makes comics different is that there is sequence that happens, so that in panels, you can show, and let's see if I can get back to the beginning. You can, sorry, this is taking too long. You can show what happens through the sequence of a comic strip so that it helps people, put things together. I think it can help people understand outcomes. You can demonstrate behaviors and then show what happens as a result of the behavior because it's narrative and it's sequential. And so I think, and so here, like the kinds of stories you can tell, like it can be true story. And I think people are very interested in stories. Some people process information better through story. So that's where I would make a distinction between something like an infographic and comics.
So I think somebody, Jeanette Bradley, distilled what you were saying, and I think it's really useful saying a story told across time versus a static image.
Yes, exactly.
So I'm going to combine a couple things because some people were asking about process. There was a specific question about what software you use, but then there were also some questions about collaboration and, when you work with folks, if one person is doing art and one person is doing the story,
Mhm.
a little more information about that.
Yeah, so there are some like this one that I do myself, and I've been learning to use a software program on the iPad called Procreate, which I'm just going to say is not the most intuitive software, but I'm learning it because I think it allows me to use layers in a way that speeds it up. Up until a year ago, I did everything with ink and pen, and errors, could be a huge problem, and there was a lot of scanning, and so Procreate does make it easier for me to do it that way. I also work with a lot of other artists. I didn't have a chance to show all the artists that I've worked with, but typically, I'm a communications professional. I start with a creative brief in which I really identify who the audience is and the key messages, and think a lot about what I'm trying to achieve. And then I often work with subject matter experts, and I develop a script. And the script includes both the writing and my ideas about the image. For some things like No Ordinary Flu, I actually storyboarded out because I had to sell people in my department on this idea. So I storyboarded it out. But usually when I work with an artist, I'll just kind of put down my ideas, because in comics, you have to think about what can you carry, what can you have the illustrations carry in terms of the meaning, and what do you have the words do? So you have to think about both at the same time. And the great thing is you can really lean on the image, you can really lean on the sequence to help carry information. So you don't have to have so many words, but you have to think about them at the same time. And then typically then I'll meet with the artist and we'll sort of riff off of it together. And the artist may have other ideas of how we could express that. And sometimes we end up tweaking the script in the text, also working together. And then there's usually iterations of rough drafts and then final drafts. So, and in the graphic public health book, I include a chapter about how I create comics to help people who want to get started.
So we are almost at time, so I'm going to ask one more question that is sort of the perennial question of graphic medicine. How do you respond to people who worry their adult audience won't find comics appropriate?
Well, I'll just say that that comics are being much more widely accepted in the United States as a medium for all people. And if you look at almost any issue, seems like, of the New York Times Sunday issue now, there's almost always a comic in there. JAMA has had comics within their esteemed journal. NPR has a really wonderful comics artist, Malika Gharib, who has done some of the best COVID comics I've seen. So I think that it's coming out more into the mainstream. And so I think a lot more people are getting used to it. I know there were people in my department who initially thought that it was inappropriate to use comics to deal with something as serious as a pandemic. And they've not only come around, but are enthusiastic supporters now that we've seen what we can do with it and how much traction we get with it.
Thank you so much. I'm going to take back the screen sharing to do the last few. Uh, yes, last few wrap up things. Okay, there we go. So again, thank you all for joining us, and thank you, Meredith, for that wonderful presentation. We had a lot of folks discussing and sharing some things in the chat as well. So it definitely led to a lot of good interaction. And thank you all for attending and participating in the presentation. The link for the class evaluation is on the slide and will be shared in the chat. We found it works best to copy and paste it into a browser rather than directly clicking on the link. A reminder that you will receive an email from us in about a week with a link to the recording. And then one more reminder that this session has been part of the NNLM Virtual Disaster Preparedness Forum. And the next session will be next Wednesday, September 27th. We're actually doing a graphic medicine virtual book club discussion. We'll be using Don Brown's Drown City, Hurricane Katrina, and New Orleans to talk about emergency preparedness, equity in preparedness, communication, and then also using graphic novels as preparedness education. Finally, we encourage you to check out the newly updated NNLM Emergency and Disaster Resources Guide, which serves as an online collection of resources and tools relevant to disaster and emergency preparedness. So once again, thank you for joining us and enjoy the rest of your afternoon.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.